Hello everyone. As UTA students, we would like to conduct a community project regarding on the drug awareness for teenagers through our video presentation. Our objectives are to increase teenagers' knowledge of drug abuse, to equip teenagers with diffuser skills towards illegal drug abuse, and to encourage teenagers to be proactive in fighting against drug addiction. Our video presentation has been divided into 5 main chapters. Chapter 1 Symptoms for drug addiction. Chapter 2 Legal punishment for illicit use of drugs. Chapter 3 Causes for drug addiction. Chapter 4 Negative impact of drug consumption. Chapter 5 Treatment for resolve drug addiction.
Hi everyone, I will talk about the symptoms for drug addiction. Drug addiction is a physical and psychological need to continue using a substance despite its harmful or the dangerous effect. It is important to keep in mind that these signs do not appear in every case or for every drug addiction. However, these signs appear often enough that they are worth noticing and responding to with appropriate treatment. When the time passes, the drug addict may need larger doses for the drug to get high. If they take it frequently, the drug addict will feel that even without the drug is more difficult. Attempt to avoid drug may cause the drug addict strong desire and make them feel physically sick. Furthermore, the drug addiction can split into different categories. In physical symptoms, when the drug user withdraws a drug, a physical symptom that may appear, so the drug user will spend more money to buy the drug. When they are avoiding the drug, they will seeking the drug uncontrollable. They will feel that use the drug regularly because they will increase the tolerance. The body experiences reduced effect of the substance over time, so the drug user may feel the need to take more to achieve the same effect. More frequent illness also is the symptom of drug addiction. Drug abuse will damage the immune system functioning and alter body chemistry in multiple ways and will make addicts more prone to cold, flu, pneumonia, allergic attack, bacterial infection, and a host of other potential illnesses and diseases. The physical effect of abusing a substance can be severe and include overdosing. However, for a person with substance use disorder, this effect will not be enough to prevent future overuse. The drug user may facing the financial difficulty because the expensive substance can lead to sizable and regular financial sacrifice to secure a regular supply. In social symptoms, the drug users are not aware that they have a problem. They might be aware of physical dependence on the substance but deny or refuse to accept the need to seek treatment, believing they can quit anytime they want to. The drug user also will accept consumption or abuse of substance. Some types of substance use disorder can lead an individual to consume unsafe amount of a substance. They also will face the legal issue. This is more a characteristic of some alcohol and illicit drug dependence. Legal problems may occur either because the substance impairs judgments or causes the individual to take more risk to the extent of causing public disorder or violence or breaking the law to get the substance in the first place.
Illegal use of drug will bring legal punishment. Anyone who abuses drug or contains drugs ingredient in his or her body, it will get the serious punishment. For the case who contain drugs, they will be punished with a fine not exceeding 5,000 ringgit or imprisonment not exceeding 2 years. For those who possess less than 2 grams of heroin or morphine, either imprisonment not exceeding 5 years and fine not exceeding 20,000 ringgit. And who possesses less than 100 grams of prepared opium and 5 grams of raw opium or coca leaves or cannabis poppy plants will get the same punishment. However, someone cultivation of cannabis will life imprisonment and whipping not less than 6 strokes, who possesses of 2 to 5 grams of heroin or morphine, 5 to 50 grams of cocaine, 20 to 50 grams of cannabis, 100 to 250 grams of opium, and 250 to 750 grams of coca leaves, with imprisonment not less than 2 years and not exceeding 5 years, and whipping not less than 3 strokes but not more than 9 strokes. And those in possession of 5 to 50 grams of heroin and morphine, 250 to 1,000 grams of opium, 50 to 200 grams of cannabis, 15 grams or more of cocaine, and 715 grams or more of coca leaves get punishment of imprisonment for life or not less than 5 years and with whipping not less than 10 strokes. Lastly is who possesses of 15 grams or more heroin or morphine, 1,000 grams or more opium, 200 grams or more cannabis, and 40 grams or more cocaine will mandatory death.
To understand why teens use drugs, one must look at each teenager as an individual with different needs, thoughts, and feelings. The reason they use drugs is as varied as to why adults use them. In this video, we have concluded 8 common reasons teens abuse drugs. Firstly, to fit in. Making friends and establishing oneself at school can be difficult for adolescents. The teenage years often come with many insecurities, low self-esteem, and fear of not being accepted. In order to fit in, to feel cool or join an older, more seductive social circle, many teens will start buying and using drugs. Many teens use drugs because others are doing it, or they think others are doing it, and they fear of not being accepted in a social circle that includes drugs using peers. Secondly, to feel good. Many adolescents abuse drugs to get high. They are looking for a thrill, an intensified feeling that they cannot be obtained through simple pleasures like food or exercise. This is where the addiction cycle starts to kick in. Drugs interact with the way our brain produces pleasure and the way our body experiences pleasure. When drugs are used, the brain creates up to 10 times the normal amount of dopamine and euphoria a person should ever experience. It is an unnatural chemistry that takes place, but our brain remembers it and craves for it. Thirdly, to experiment. Adolescents are often motivated to seek new experiences, particularly those they perceive as thrilling or daring. However, the brain does not finish developing until the age of 25. The last part of the brain to develop is the one that controls rational decision-making, self-control, and judgment, making adolescents more prone to trying risky and daring activities. Drug is often an easy, accessible outlet for experiment that can severely impact the development of teenage brain. Fourthly, competition. The need to perform, to impress, and to make proud is a great pressure for adolescents and young adults. Whether in school or on the field, young people consistently want to prove that they are the best to their peers and parents. The competition to be outstanding, however, can be intense. In academics, for example, teens and young adults often rely on the misuse of prescription stimulants as smart drugs or study aids to improve academic performance. Fifthly, attention. Teens often experience a lack of purpose or talent. They feel like they are not good enough to shine or are lacking something to make them special. These feelings may drive them toward drug abuse. Some youth do not know how to become the best, so they choose to become the worst in hopes of getting their parents' and teachers' undivided attention. Sixthly, lack of education. Some adolescents and young adults grow up thinking drug use is normal. Their favorite musicians are singing about it, the movies are glamorizing it, the TV ads are selling it. Whether you are sad, can't sleep, or have a headache, there is a drug for you. Many do not understand the consequences of drug abuse. Many do not know how it can harm their minds, bodies, and relationships. They need proper education. They need someone to tell them the truth about drugs. Seventhly, to relieve stress. Some adolescents suffer from depression, social anxiety, stress-related disorders, and physical pain. Using drugs may be an attempt to lessen these feelings of distress. They use drugs to forget or replace their negative feelings with substance-induced pleasure. Lastly, influence of family throughout childhood. Factors like our quality of life, presence of abuse, or exposure to different stress such as parents' divorce play a big role in the development of drug addiction. Family risk factors for teenagers engaging in drug abuse include low parent supervision or communication, family conflicts inconsistent of severe parental discipline, and family history of drug abuse.
Drug abuse will bring drawbacks to the health of drug addicts, family members, and society. When someone injects the drug directly into the bloodstream, it will cause a large amount of neurotransmitters known as dopamine to be generated. Neurotransmitters will affect someone's emotion and feelings. In short, drug abuse will give rise to the drug addicts feeling high. As time flies, this behavior will turn into drug addiction and making someone feel anxious and depressed. Also, the negative impact caused by drug abuse, such as poor working performance or poor academic performance, extreme weight loss, and loss of interest, will affect someone's daily life. Moreover, the worst scenario is that cardiovascular disease, stroke, and lung disease will then appear and damage the drug addict's health. Furthermore, drug abuse will break the harmony of a family. It can affect the family in several ways, such as finance, relationship, or safety. As mentioned earlier, drug abuse will cause poor working performance and lead to unemployment. Being unemployed will directly reducing the family's financial support. Besides, drug abuse will also affect someone's emotion. Usually, drug addicts will have a low tendency to deny their feelings. They will shout at their family members when they feel impatient, depressed, or irritated. This unstable emotion will create a gap between drug addicts and their family members. They will try to keep themselves far away from their family members to avoid hurting their family mentally. Somehow, drug addicts will also injure their family members physically. Perhaps they have no intention to do so. However, they are unconscious and they lost the ability to control their action after taking the drug. Apart from that, drug abuse will increase the unemployment rate as it influences the working performance and causes drug addicts to become job losers. Also, drug abuse will reduce country productivity and give negative consequences to economy. On the other hand, drug abuse also increases criminal cases over the world. Generally, those drug addicts will be unemployed and cause them to lose their financial ability. Hence, the premium selling price of the drug is unaffordable for drug addicts. Still, they wish to purchase the drug. Those drug addicts tend to finance their daily drug consumption in a few illegal ways, such as stealing, robbery, housebreaking, or others. This criminal behavior might harm the safety of citizens. Finally, drug abuse will affect society by causing the citizens to feel unsafe and living in fear.
To overcome the complex social and serious public health problems resulting from drug addiction issues, Malaysia government initially started to organize various institution treatments and rehabilitation programs to move towards using medication to treat drug addicts. For example, addiction and mental health rehab, which organized for helping patients to regain their self-confidence and self-esteem, as well as learning recovery process for drug addiction. Second, enforcement and security program which aim to take action on public complaints of drug abuse activity and detect drug addicts who refuse to voluntarily undergo treatment and rehabilitation. Third, preventive drug education to educate the public about the abuse of dangerous drugs and maintain the public support in fighting abuse of dangerous drugs. Fourth, treatment, medical and rehabilitation program which provide a range of treatment and rehabilitation modalities for special group of drug users. That's all for our presentation. Thank you for watching.